Wisdom teeth, also known as third molars, often emerge in early adulthood. These teeth typically make their appearance between the ages of 17 and 25, a period when most people are transitioning into adulthood. They are the last teeth to develop and erupt in the back of your mouth. Positioned at the very end of the dental arch, they can sometimes be difficult to clean and maintain. Sometimes there isn't enough space for them to grow in properly. This lack of space can cause the wisdom teeth to become misaligned or even horizontally positioned. This can lead to various problems. Crowding of the teeth, pressure on adjacent teeth, and even damage to nearby dental structures are common issues. Impacted wisdom teeth are a common issue. An impacted tooth is one that has failed to fully erupt into the mouth due to obstruction from other teeth or bone. They are blocked from fully erupting by other teeth or bone. This blockage can cause significant discomfort and lead to more serious dental issues. This impaction can cause pain, swelling, and infection. The pressure from the impacted tooth can also lead to headaches and jaw stiffness. Partially erupted wisdom teeth can also trap food and bacteria. This trapped debris can be difficult to clean, leading to further complications. This creates a breeding ground for infection and gum disease. Infections can spread to other areas of the mouth and even to other parts of the body if left untreated. In some cases, cysts or tumors can form around impacted wisdom teeth. These growths can cause damage to the jawbone and surrounding teeth, requiring more extensive treatment. Dentists often recommend removing wisdom teeth to prevent these complications. Early removal can help avoid more serious issues and promote better oral health. It's easier to remove them when you're younger and the bone is softer. Younger patients tend to recover more quickly and with fewer complications compared to older adults. Before your extraction, there are several important steps to ensure a smooth and safe procedure. Your dentist will review your medical history in detail. This includes any past surgeries, chronic conditions, and any other relevant health information. It's crucial to inform them about all medications you take, including prescription drugs, over-the-counter medications, and any supplements. This helps prevent any adverse reactions during the procedure. Be sure to mention any allergies you have, especially to medications or latex. This information is vital to avoid any allergic reactions during the extraction. Your dentist will take X-rays of your mouth to assess the position of your wisdom teeth. These X-rays provide a clear view of the teeth's alignment and any potential complications. These images help them plan the extraction procedure meticulously and anticipate any potential challenges such as impacted teeth or proximity to nerves. The dentist will discuss the type of anesthesia they recommend, either local or general. Local anesthesia numbs the specific area, while general anesthesia puts you to sleep during the procedure. They will also explain the risks and benefits of each option. Understanding these can help you make an informed decision about your comfort and safety during the extraction. If you're having general anesthesia, you'll need to arrange for someone to drive you home after the procedure. This is because the effects of the anesthesia can impair your ability to drive safely. Avoid eating or drinking anything for several hours before the extraction, as instructed by your dentist. This is particularly important if you're receiving general anesthesia to prevent any complications during the procedure. Following these steps carefully will help ensure that your wisdom tooth extraction goes as smoothly as possible, minimizing risks and promoting a quicker recovery. For upper wisdom teeth extraction, you'll receive local anesthesia to numb the area. Once the anesthesia takes effect, the dentist will gently loosen the tooth from its socket. They use specialized instruments to elevate the tooth and apply controlled pressure to dislodge it. Upper wisdom teeth are often easier to extract than lower ones because the bone is less dense. The dentist will carefully remove the tooth from your mouth. They will then clean the extraction site to remove any debris or fragments. Lower wisdom teeth extractions follow a similar process but can be more complex. The dentist will administer local anesthesia and may make a small incision in the gum tissue to access the tooth. They will use dental instruments to carefully loosen the tooth from its socket. Lower wisdom teeth often require sectioning, especially if they are impacted. This involves dividing the tooth into smaller pieces for easier removal. The dentist will then remove the tooth fragments and clean the extraction site thoroughly. Alright, so after the tooth extraction, the dentist will control any bleeding from the socket. They may use gauze to apply pressure or place a special material that promotes clotting. If necessary, they will stitch the gums closed with dissolvable sutures. These sutures help to minimize bleeding and promote proper healing. Then the dentist will place gauze over the extraction site to absorb any further bleeding. They will instruct you to bite down on the gauze to apply pressure. Following your wisdom tooth extraction, it's crucial to follow your dentist's post-operative instructions carefully. This includes taking any prescribed pain medications as directed. Over-the-counter pain relievers like ibuprofen can also help manage discomfort. Applying an ice pack to the outside of your cheek near the extraction site can reduce swelling. Keep the ice pack on for 20 minutes at a time, with 20-minute breaks in between. And get plenty of rest in the days following your surgery. Avoid strenuous activities that could dislodge the blood clot forming in the socket. Stick to soft foods for the first few days after your extraction. This includes items like yogurt, applesauce, mashed potatoes, and smoothies. Avoid anything crunchy, chewy, or spicy, as these can irritate the extraction site. Do not use a straw for drinking, as the suction can dislodge the blood clot. Gradually reintroduce solid foods into your diet as you heal. Make sure to stay hydrated by drinking plenty of fluids, such as water or clear broth. Avoid alcohol and carbonated beverages for at least a week after surgery. They can interfere with healing and increase the risk of complications. Section 8. Oral hygiene after wisdom tooth extraction. Maintaining good oral hygiene is essential for proper healing after wisdom tooth removal. However, it's important to be gentle around the extraction site for the first 24 hours. Avoid brushing or flossing directly on the surgical area. Instead, rinse your mouth gently with warm salt water several times a day. After the first day, you can resume brushing and flossing your other teeth as usual. Be careful not to disturb the extraction site. Continue rinsing with salt water after meals and before bed to keep the area clean and promote healing. Section 9. Potential complications and when to seek help. While wisdom tooth extractions are generally safe, complications can sometimes occur. It's important to be aware of these potential issues so you can act quickly if they arise. Contact your dentist immediately if you experience any of the following symptoms, as they could indicate a serious problem that needs prompt attention. First, excessive bleeding that doesn't stop after applying pressure with gauze. This could be a sign of a more serious issue that needs medical intervention. Second, severe pain that isn't relieved by pain medication. While some discomfort is normal, intense pain that persists could indicate complications. Third, swelling that worsens after a few days, fever or chills. These symptoms could be signs of an infection that needs to be treated promptly. Fourth, numbness or tingling in your tongue, lips, or chin that persists. This could be a sign of nerve damage, which requires immediate attention. Difficulty swallowing or breathing is also a serious concern. Lastly, a foul odor or discharge from the extraction site. This could indicate an infection or other complications that need to be addressed by your dentist. These symptoms could indicate infection, dry socket, or nerve damage. Each of these conditions requires different treatments, so it's crucial to get a professional diagnosis. Prompt treatment is crucial to prevent further complications. Don't hesitate to reach out to your dental care provider if you notice any of these symptoms. Early intervention can make a significant difference in your recovery process. Section 10. Long-term outlook after wisdom tooth removal. Most people recover fully from wisdom tooth extractions within a week or two. Once the extraction sites heal, you can enjoy a healthier mouth and a reduced risk of dental problems. Remember to attend regular dental checkups and cleanings to maintain good oral health. If you're considering wisdom tooth extraction, consult with your dentist to discuss your individual situation. They can assess your teeth, discuss the risks and benefits of the procedure, and help you make an informed decision. Section 11. Importance of following your dentist's instructions. Following your dentist's post-operative instructions diligently is crucial for a smooth and successful recovery after wisdom tooth extraction. These instructions are tailored to your specific case and are designed to minimize discomfort, prevent complications, and promote optimal healing. Remember that every patient is different, and healing times can vary. By adhering to your dentist's guidance, you can ensure a positive outcome and enjoy long-term oral health. If you have any questions or concerns during your recovery, don't hesitate to reach out to your dentist's office for clarification and support.